Hello, my name is Dr. Jerry Law, and I'm the Director of Family Education and Leadership Training for Meadows Behavioral Healthcare. Thank you for joining me for a very important discussion on addiction. I have a question for you. What do you think when you hear the word addict? When you hear someone introduce themselves by saying, "Hi, my name is Jerry and I'm an alcoholic," what goes through your mind? Pause and consider this for just a moment. Now, I, for one, have become less and less a fan of the word addict over the years, even though I continue to use it every day. Well, I believe there's nothing wrong with the word. However, for me, the issue is one of its overuse. By that, I mean we hear about individuals becoming addicted to mood-altering chemicals, such as cocaine, alcohol, heroin, and others, as well as addictions to behaviors like compulsive gambling or compulsive sexual behaviors. Then we hear individuals talk about addictions to shopping, shoes, and candy bars. So just what are we to believe? Well, for the purposes of this video, I will be speaking primarily about addictions to mood-altering chemicals as well as what are called process addictions or compulsive behaviors. More specifically, I'm going to be talking about substance use disorders, sex and love addictions, as well as eating disorders. One could argue that much about what I'll be sharing is also applicable to mood disorders, anxiety disorders, and trauma as well, and I'll let you decide. So let's begin with another very controversial question. Is addiction a disease or not? Well, my intent here is not to spend a great deal of time on that debate. Actually, I would direct you to Dr. Kevin McCauley's video, Pleasure Unwoven, for what I believe to be about the best conversation available on that topic. You can find Dr. McCauley's video by visiting his website at www.drkevinmccauley.com, or just Google search Pleasure Unwoven and you'll find it easily. You can also go to the Meadows website and click the link to the bookstore. You can find it there as well. For purposes of this video, it matters not if you refer to addiction as a disease or a disorder. We can certainly agree that when these behaviors reach the level of serious, life-damaging consequences, something is amiss. Personally, I've always been rather fond of John Bradshaw's definition of addiction when he said, "An addiction is a pathological relationship with any mood-altering experience that has life-damaging consequences." Let me repeat that. An addiction is a pathological relationship with any mood-altering experience that has life-damaging consequences. Sums it up quite well, I believe. The American Medical Association refers to addiction as a primary, chronic, progressive, and left unchecked, fatal disease. Since it is primary, the underlying issues will be very difficult, if not impossible, to address until the use of whatever mood-altering chemical or behavior is discontinued. This suspension or interruption is often called detoxification. Detox is not treatment, but rather a necessary antecedent to treatment, making it possible for clinicians to begin to unravel the issues under the surface. According to the AMA, it is chronic in that it does not have an acute onset, such as a broken bone or an infection, and generally is long-term in nature. It is progressive due to the fact that it has a recognizable course, and the disease or disorder can be charted, and left untreated or interrupted, it is generally fatal. Though the death certificate may name things like respiratory arrest or heart failure or blunt force trauma as the cause of death. Now, in the treatment world, we tend to define addiction as a biopsychosocial as well as spiritual disease or disorder. I'd like to spend the majority of this video exploring each of these four components to help us better understand the nature of addiction. First, let's discuss the biological aspects of addiction. While many physiological maladies may be at work, the fundamental biological aspect of the disorder is neurological. I share the following brief explanation of neurological malfunction caused by addiction in a video entitled The Many Uses of the Words Sober and Recovery. And I'll just duplicate that explanation here. Your brain is made up of many types of cells, including neurons. It's been estimated that you have somewhere near 100 billion of these cells, neurons. I'm not sure who counted these, but regardless, it's clear we all have a whole bunch of these amazing cells. The primary job of neurons is that of communication. Each neuron has a central core or nucleus along with tendrils called axons and dendrites. For neuron A to communicate with neuron B, the axon of neuron A reaches out to the dendrite of neuron B. Now, these two tendrils don't actually touch, but come very close to one another. The axon of neuron A releases neurochemicals, such as dopamine, serotonin, norepinephrine, and others, into the space between itself and the dendrite of neuron B. The second neuron receives these neurochemicals in a particular order and understands the message. It's truly remarkable. The information travels down the dendrite to the nucleus of neuron B, and then it's passed on to other neurons. Now, that's a terribly simplistic explanation, but does demonstrate the fundamentals of what's taking place in our neurosystem. The psychological aspects of the disease help us understand the behaviors that our loved one may be demonstrating and often seem odd or bizarre to us. As already mentioned, neurological processing of information is compromised in addiction. When the brain is impaired, it should come as no surprise that behavior changes occur as well. Addicted individuals frequently will engage in behaviors designed to protect the disorder while damaging relationships with the very individuals who wish to provide assistance in overcoming the addiction. Your natural response may be to ask your loved one to sit down and let's have a rational, reasonable, logical conversation about the issues. Unfortunately, a person engaged in these behaviors is in the grips of an irrational, illogical, unreasonable disease or disorder. It's not a metaphor to wonder if your friend or family member is thinking straight. Albert Einstein allegedly coined the phrase that insanity is doing the same thing over and over and expecting a different result. Well, I don't know any group of individuals who bear this out more than those who are actively involved in an addiction. Next, let's consider the social aspect of addiction. Humans are, by design, social beings. Our natural interactions with others may be limited or extensive. And when an addiction is present, these interactions are affected. In some cases, individuals will pull away from the most important persons in their lives and isolate. This tends to be a protective measure, as being around others often carries a certain level of accountability. If your loved one is experiencing guilt, anger, or shame regarding the issues they're facing, isolating may be a coping mechanism that enables the disorder. Others often tend to begin to associate with groups they once would not have been involved with. Drinking and using buddies may be viewed by your loved one as a support system, while you are stunned that the person that you have known for years is now hanging out with that crowd. Either way, it's not unusual for you to find yourselves perplexed by the social changes you see in your loved one. Also, there's a spiritual component to examine. Please note, when I use the word spiritual, I am not necessarily referring to religion. Your loved one may or may not have religious training or belong to any kind of ecumenical organization. When I say spiritual, I'm referring to our value system, our morals, our fundamental beliefs, or one may say the mind-body connection. This aspect of our life is also compromised in addiction. I have a friend who says that when he was active in his addiction, he could not lower the bar fast enough to keep up with his behaviors. So, with this understanding about addiction, it's very important to also address the moral aspects of the disease or disorder. It comes as no surprise to anyone that a person caught in addiction often demonstrates immoral actions. The explanation of addiction already given in no way excuses the bad choices, decisions, and behaviors of an individual involved in these diseases or disorders. Rather, the bio, psycho, social, spiritual dimensions of addiction helps explain those actions. We, as members of the human race, are responsible for our actions. Yes, there are mental illnesses that render individuals truly incapable of making appropriate moral choices, but that's not the topic at hand. Becoming educated on this explanation of addiction does, however, go far in helping both the addicted individual and those affected by the individual heal from the damage done by understanding what's happened to them. Now, let's take just a few minutes to discuss how you can support your loved one in treatment for addiction. First, remember that biopsychosocial spiritual model and know that while your loved one is active in the addiction or even in early recovery, attempts to have those rational, reasonable, logical conversations you'd like to have may be very limited. The message your friend or family member will most likely respond to is one of love, care, and concern. A message that says, I will support recovery and I will not support anything else. This is not a punitive statement, rather one that tells your family members that you love them enough to allow them to experience the consequences of their choices. It's a message of respecting their dignity while also establishing healthy boundaries that are designed for your own self-care. For some people, hearing their loved one identified as an alcoholic or addict can be difficult or even painful. Please know the 3 C's of Al-Anon. You didn't cause it, you can't control it, and you can't cure it. Your loved one is not saying, hi, my name's Jerry and I'm bad, wrong, stupid, evil, and weak. No, he's saying, hi, my name is Jerry and I recognize the biopsychosocial spiritual aspects of the disease or disorder from which I am in recovery, and I am committed to working a program that will support my well-being. There's a big difference in letting your friend or family know that you stand with them in support of recovery and will go far in bringing a